talk together, which happens to be my most popular talk. I'm asked to give this all over the country because it's a real issue. Because as our workforce, physician workforce ages, we have a lot of problems to deal with. So the bottom line of this is I hope that you guys will consider implementing a policy on aging over time. You can't do it immediately, but that's what I'd like you to consider. And I'm going to give you a lot of reasons to why that's a good idea and why that you shouldn't put it off any longer than you already do. The trend, as Nancy talked about, is more physicians are working longer because they can't afford not to. They're being employed, and what we're seeing in some parts of the country is the hospitalists are basically internists or family practice people that are coming back into practice and now are taking care of acute care patients in a hospital setting, and they probably weren't qualified to do it when they were in active practice, much less now that they've retired and come back. So there's a real issue of how we're going to deal with all these people. And as always, there's always more than one side to the story. You've got to balance physician advocacy and patient safety, and it should be it should be in reverse order. Patient safety has to come first. That's the only reason you guys are in this room. That's the only reason organized medical staffs exist, is for patient safety. At the same time, you've got to be sensitive to physician advocacy and trying to do the right thing for the right reason when it comes to a physician, particularly if he or she is aging. So the two issues converge, and there's no way to keep that from happening. Age is not relevant to the practice of medicine, but aging is relevant to the safe practice of medicine. That sounds kind of like a safe way to go. I've given you some introduction. We're going to talk too about a physician health committee because I feel like that's where the aging physician needs to be handled or dealt with. It's a little different role for that. Usually it's a pea in the bottle kind of committee and that's it. But it really should be a committee on impairment at any level, whether it's an anger management problem, whether it's a personal hygiene problem, whether it's a boundary problem, whether it's an aging problem, whether it's a communication problem. The physician health committee is a good place for that to be. And then I'm going to give you some specifics on aging and illness, how they're assessed and evaluated, a little bit about the perfect storm, strategies for safety.